Good morning, everyone, and welcome. Thank you for joining us today. Today is Monday, December 4th, 2023, and we are here in the Commissioners' Conference Room on the second floor of our Larimer County Administrative Services Building. We're here for a work session with our Community Justice Alternatives group, and I am Larimer County Commissioner Jody Scheib-McNally, Chair of the Board of County Commissioners. I welcome you to our work session today. Joining me at the conference table is my colleague, Commissioner John Confalis and Commissioner Kristen Stevens. Good morning, colleagues. And also joining us at the table is our County Manager, Lorinda Volker, and also in the room is our Assistant County Manager, Lori Cadridge. I am now going to turn this over to our Director of Community Justice Alternatives, Emily Humphrey, and I know she has also Jill Fox with her. I just saw your husband at the other building, so. I'll let you proceed. Thank you all for being here today.
Well, thank you for having us here. My name is Emily Humphrey, and I'm the Director of Community Justice Alternatives for residents. I should start that again. Okay, now that I have my button pushed. I'm Emily Humphrey, and I'm the Director of Community Justice Alternatives. I also have with me Director Jill Fox from Alternative Sentencing Department. Tim Hand, who's our Director of Community Corrections, is unable to attend today, so I'm just going to let you know that I am covering for him, so I know just enough to get in trouble, so I'm just going to put that out there. We thought it was very important for the end of the year, for our fourth time in front of you, talking about CJA and our programs that we have when it revolves around criminal justice and behavioral health, to really kind of do a year in review. And we thought it was really important to have our three directors here, now two, but three directors here to kind of talk about the good work that we've done this past year. Some of the slides that we prepared for you are simply just fun, but then other slides are packed full of good information as you go on next year to the legislative session. If folks reach out to you and have questions about how we run our programs, how much money we save the county by having alternatives to traditional incarceration. So some of these slides are very thoughtful in the point that you could pull a slide out and be able to answer some questions if people approached you. So this is our year in review, but it's also our looking forward. And so we want to talk about what we want on the horizon for 2024 to kind of see and get your input on as well. So obviously, the benefits to Larimer County, I think, are huge when it comes to community justice alternatives. With our new facility, if we were at full capacity between all of our buildings, community corrections, ASD for men, and then ASD and community corrections for women in our all-women's facility, we would have the room for 680 clients. That's an increase of 170 since we opened our new facility in May of 2023. And it goes without showing that alternatives to traditional incarcerations work. They reduce recidivism, allow folks to keep their job, to keep their livelihood, to not lose their housing, to be able to pay child support so that we don't see them come back revolving through our doors. So we are very blessed in Larimer County to have all these alternative sentencing programs to give people the opportunity to stay successful in their community, although still being accountable for their crime. So what's kind of funny is CJA never had a mission statement or a vision statement until this year. When we kind of branched together, it just did not happen. So we had some really good retreats, and we had a facilitator, and Michelle Bird was fabulous and kept us all on track. But I did want to talk about our mission between CJA. Community Corrections has a mission statement, and so does ASD, but as a service area, we didn't. And so our mission for CJA is that Community Justice Alternatives prioritizes community safety and reduced recidivism by providing accountability, resources, and support to justice-involved individuals. And I think that's very, very important. We want to make sure that there's the public safety aspect of it, but also that we're helping folks as they move forward, giving them support, and also supporting our staff that do really hard work each and every day. We also created a new vision, and our vision is CJA envisions a safer community by creating an inclusive culture for highly motivated and well-trained staff who utilize innovative practices that are cost-effective, improve the lives and outcomes for justice-involved individuals. And I couldn't speak more to that we have absolutely incredible staff that work so very hard. They come to work because they enjoy coming to work and they want to make an impact. And I think that truly shows, and I think that trickles down to the clients that we supervise. And then when we did the opening of our new women's facility, we have our mantra, Courage to Change, and that's written in our women's facility, but it applies to all of CJA. It's the courage to change for those that are justice involved to not think that their past defines where their future goes, but also to challenge our staff that for the past 20, 30 years we've done it this way, and maybe we need to pivot and turn, and the courage to look at justice involved individuals in a little different light than we've had in the past to be even more successful than we already have been. We also have these core values that we talked about at the women's facility opening, but we changed the definition. We got a group of subject matter experts together to really look at what are the values that we want to instill for our staff and what values we want to instill for those under our supervision. And the goal is to have these in all 3 of our buildings, to have these up so that folks can call each other on it if they're not seeing these core values really followed. So for our respect, we want to commit to creating a culture where staff and clients feel physically, mentally, and emotionally supported. Connection, we want to build meaningful connections, meaningful, inclusive, and collaborative relationships between our staff, our clients, and our community. And empowerment, we want to commit to offering opportunities that motivate not only individuals under our supervision, but our staff as well, to discover self-sufficiency and personal growth. And number 1, in some respects, is safety. We want to make sure that everyone under our roof is safe. So we commit to providing a stable and secure environment that promotes the welfare of our staff, clients, and our community. So any questions on those? I'm really excited that we have them. It's going to be a really nice thing. When we have new employees, we're going to have a nice card, and I'm going to tell you that we stole this from Heather O'Hare, but we're going to have our core mission, values, and mission and vision, and our mantra, and we're going to send it to folks before they ever start working with us, so they really know what we have going in.
I had a quick question.
You bet.
I think that's wonderful that you have this and the mission and the core values. How also does this braid into our guiding principles? Do you kind of share both and
100%.
Read 'em? Okay.
So when we had this up, Michelle Bird was fabulous. So we have the guiding principles next to what our core values were, and they all basically overlapped in some respects. So we absolutely did. We wanted to make sure that we were following what Larimer County, their guiding principles as well. So thank you for that.
Thank you. Commissioner Kapalis, did you have a question, sir?
Okay.
All right, thank you.
So the next slide, I think, is probably the one you're going to be most interested in, at least in my opinion. And that's the cost of a jail bed day versus a cost of a bed with us at CJA. Now, what I will tell you is all of the costs has gone up in the community, and lots of things, a lot of different things that go along with that. But it used to be that the jail cost about $120 and $130 a day. It's now $175.78 per day to house a traditional individual in a jail setting. Community corrections is $101.26 a day. Work release is $95.95 a day. And so you can see we're significantly lower than a traditional jail bed. We're higher than we have in the past. Now, what I will tell you is that our numbers are not back to pre-pandemic levels yet, and that's consistent across the state. If our numbers go higher, our costs for community corrections, our costs for ASD will come down, but this is based on our average daily population for the first 3 quarters of this year. So obviously we couldn't give you the 4th quarter. Now, what I do put in there, and this is kind of a throw-off, but pretrial. To have someone on pretrial, it costs $4.89 a day. Now, I cannot say that we're saving. That would be like $31 million saving if we said everyone was in jail, because we know that a lot of individuals are going to come out on a PR bond. They don't have the criminal history that would cause them to stay incarcerated. But this number is significant when we show you the pretrial slide and how many people we supervise every month on pretrial. It is saving the taxpayers a tremendous amount of money.
I'm curious, Emily, though I know we always talk about going back to pre-pandemic levels, but we may not be able to get there with just the cost of inflation and wages and other costs. Would that be an accurate statement? Because pre-pandemic levels maybe of these programs, but just the cost might never go back down. What are your thoughts on that?
I think if we can figure out why we're not filling our beds, and that's historically across the country, then I think the numbers will financially come down. We still consistently have conversations with our partners, our DA, our public defender, our judges about not turnover, but resolution of cases, the timing of the resolution of a case, they're still longer than they should be. And so there's a lot of different factors that go into play with that. If we can get that number down and folks sentenced earlier, they may not get credit for time served, meaning they spent 30 days in jail when they could have spent 20 with us and still maintain their job. So I think that will bring the cost down as well. But again, food costs have gone up, and I don't know if you can speak to that, the percentage of what food costs has gone up just for our folks.
I think for the 2024 year, food costs are averaging going up 6.4%. That's just based upon the, and I forget the acronym right now. It's an annual cost that runs, that drives the market. So that's going up significantly. Like Emily was saying, we do need a certain amount of people regardless of the amount of clients in our building to run our facility safely. So when those numbers do go up, the cost of clients goes up, the cost will go down, because despite the number of clients that we have in the building, we still have to safely run it just based upon our building design with a certain amount of staff as well, so.
And that's the biggest thing, is we have to have the staff to cover the large amount of room that we have and to still provide the same services that we have in the past. But I think this is a very telling slide, and the next slide as well will show you the cost savings just for the first 3 quarters of 2023. So if you look at it, so far, the first 3 quarters, the jail has had 154,594 days, and we've had with community corrections 122,816, and alternative sentencing has had 31,778 days. And if you do the calculation just in the first 3 quarters of 2023, we've saved $11.6 million to Larimer County by not having them in the traditional jail bed day. Now, I'm not very good at my math, but I did it yesterday, and if I add another quarter, kind of the same way we're going, is going to be about $15.5 million by the end of the year that we will have saved the taxpayers in traditional jail bed days.
And along with that, I mean, it's hard to say now with those folks that are reflected in those numbers, but you have data to show that long-term, the outcomes are tremendously better. So that also has a number too.
Absolutely, it does.
Okay.
And then we did not provide that today. When we do performance measures, you'll be able to see that as well.
Thank you.
You bet. Oops, okay. So when you look at those numbers and how well we are saving the taxpayers' monies in regards to alternatives to traditional incarceration, it's because of our employees. So Commissioner Cavalis, here's my first picture slide. There's going to be a lot more. But our staff are absolutely tremendous. They are there because they want to be there, that this is a passion for them, and they do want to make an impact. And so in order to do good work, we need to have well-trained staff. So I wanted to talk a little bit and highlight the training that we provide to our staff. So basically, when a brand-new person comes into our facility, they are given a field training officer, an FTO, where they're following them for months at a time, and they have 170 hours of training with someone sitting shoulder to shoulder right next to them, doing daily progress reports about whether they're hitting the mark, whether they're not hitting the mark, do they need a little extra time in a certain area, because we're supervising folks and it's life and death. It can be. We need to make sure that if there's an overdose in our facility that we're able to go and render aid, and so it's important that they have that 170 hours. In addition, a brand new person not only has the 170 hours, they have a mini academy, which is 40 hours long, where they get an overview of our entire department. So they're just not in a vacuum doing just their job. They're learning all of the jobs so they can appreciate how we all connect to one another. Each staff member, depending on what building you're in, has to have required training hours. So for community corrections, they have to have up to 40 hours of training each year, no matter how many years you've been here. I believe ASD is 30, and then our administrative support staff is 16. So all of us, I have to do 40 hours every year. All of us want to do continuing education about what we're doing in our field. And so some things that I wanted to talk about in regards to our training is some specific ones that are really unique probably to our department, but we need to have CPR, AED, first aid. We do that and we get certified every 2 years, and we have refresher courses because we have saved lives before, and we want to make sure that our staff are equipped to do that. We have mental health first aid, which has been critical, and all of us take that. I think it's every other year?
Every 2 years.
Every 2 years, we're required to take that. We also have PREA, which is our Prison Rape Elimination Act, so we're learning about making sure that everyone feels safe and is not subject to any kind of sexual violence in our presence. We also have motivational interviewing, so that we're making sure when folks maybe are having a difficult time, we have the tools to use that to help them move forward. And we're really excited about our gender responsivity with Dr. Walker and Dr. Opsel from CSU in regards to how we're going to really approach women differently that are justice involved. And we have fentanyl, first responder safety, and Narcan use, and every one of us gets trained in that. And we've unfortunately had to use that, but fortunately, we've saved individuals' lives at the same time. We also have drug recognition. Go ahead.
Well, I'll wait till you're done with this slide, then I have a question.
You betcha. So we also have drug ID and symptomology, because we need to train our staff to recognize when they do searches and they find a pill or they find a drug, what is the drug? And if someone's showing certain symptoms, is that a drug overdose? Is that something that we need to be worried about? Do we need to call 911? And we're also starting some really intense training with equity, diversity, and inclusion. And we're going to talk about that further as we go down this slide. And then we also received a grant, and we'll talk about our CJAC subcommittee later on, but we received a grant that we took 10 different entities within Larimer County, and when I mean Larimer County, I don't mean our county itself, but people out in our community as well, to be trauma-informed trainers. And so they've gone out to give information about how to really approach an individual with a mental health crisis, whether you're in a law enforcement setting, whether you're in a mental health setting, whether you're in a nonprofit setting. So we've been very blessed to have that, and we continue to give lots and lots of training in that area. Go ahead.
Commissioner?
Yes, thank you, Madam Chair. Thank you, colleagues. And I was looking at the other slides coming up. It might answer my question, but I'm curious. It's a two-part question. One is, are you having any difficulties filling positions? Because sometimes we're having challenges in criminal justice and other areas regarding workforce. And then the people who you do hire, where are they coming from? What are their backgrounds? Are they social workers? Are they criminal justice folks? Are they combination?
I think we can both take that. We're doing much better in our recruiting right now. We've done a lot of good work with the Human Resources Department and how we are wording things and going, what is it called, Textio, where they're going through and making sure the language changes. Doing that, we've had a lot more success. We've had some wonderful individuals coming from college. We have a lot of kids that are, I call them kids, sorry, because I feel old, but a lot of young ones that are coming out of college for their very first job. And they're coming from AIM, and they're coming from CSU and CU and UNC. A lot of them are social workers. A lot of them are criminal justice majors. So that's been very exciting. We struggle still a little bit with our addictions therapist. So we're still working on that. Jill, do you want to speak to that?
I will say that I would like to see our retention rate increase a little bit, but I look very frankly at our program where our job is an entry-level job into criminal justice. And a lot of the staff that work in ASD, it's their first introduction. Like Emily was saying, they're brand new to the workforce, to the criminal justice workforce. And while I'd love to see them stay in our program, I also recognize that probation is a step up for them. They may work to get their CAC and they want to go into more therapy. We offer such good exposure for our staff coming on that it does offer them a lot of room to grow. We have some folks that stay on career. We also have a lot of folks that I'm just talking about that realize like, okay, I want to narrow my field down a little bit and focus a little more in here. Hate to see them go, but I also am very happy that they're finding their way in criminal justice.
And I think the one thing that I would say is that we're working very hard to give staff, and that's one of our goals for next year, is to really get staff included and not just have the supervisors making all the decisions and the leads making all the decisions, so that they have buy-in, that they want to stay with us, but recognizing that there's a lot of them that go to law school or they go to grad school and things like that, so they start with us. But we're also working to keep some of those that maybe they decide not to go and they decide to stay with us.
With Commissioner.
Just a very quick follow-up comment. I believe an acronym was used, CAC, and I think that refers to Certified Addiction Counselors.
You're correct, yes.
And secondly, while your point is well taken about folks may view it as part of their career ladder, At the same time, we do have folks who have worked there for a long time.
Yes, we have.
Jill, right next to us.
25 years in February.
You're looking
I
great.
don't plan. So, and no, we recognize that too. It's, we've got a good mix of folks. And we are seeing that as ASDs kind of branching more and getting more involved in different aspects, we are seeing people show different aspects in those, or different interests in those areas, which I respect completely. But yes, we have plenty of folks that have stayed on, and happy to say that. We've got a lot of staff with so many years in with the county that we're very happy with, so I'm one of them.
So the next slide I want to talk about is really exciting. So Derek Stahls, who's our business analyst, really wanted to find an opportunity to give a voice to staff to bring new innovative approaches to their jobs each and every day on different levels. So he created the Empower Group. So this is less than a year old, and Empower stands for Employees Making Positive and Objective Work Environment Recommendations. So it's designed to provide staff with a route to submit great ideas for change. It was originally focused on really like innovative approaches, cost effectiveness, where we would give staff, if we implemented one of their ideas, maybe a bonus because they found something that's more efficient. But then it also turned into employee morale and satisfaction as well. So there's a group that meets consisting of ASD, ComCore administration, and Derek once a month. Staff have the ability, we have a form that goes out, and they can submit their ideas either anonymously or with their name on it. This is what we'd like to see, and it goes to the Empower team. They vet it, and then it goes to the directors. So we actually have a directors Empower meeting today to go over suggestions that the staff has brought to us. And they've done great things with it, but it really focuses on supporting staff satisfaction and morale, improving efficiencies, innovative thinking, and cost savings. We've had a lot of things like, for example, we had our electronic bonds that happened years ago that was just state of the art. That came with folks just thinking outside the box. And so giving them their voice to say, I want to try something new, or I want something as simple as I'd like to have more water filtration systems in our building. I mean, little things that make a difference for employee morale, but then also big things like, could we do electronic signatures so that we don't have to print everything out? So it's been a really impressive program so far. The team is about 20 people strong, and they have lots of people submitting every day. We're going to be using Nectar points to say thank you for submitting. I appreciate taking the time and letting us know your concerns and your wishes for the future. So some other things. Did you have a question?
No, I just wanted to comment. I really like this. I think it also makes employees feel like their work matters and they're relevant. I was thinking as you were talking, when my dad worked for IBM for 30 years, one of the proud moments I remember him being besides his longevity, was he won a big innovation or suggestion award. And he got a bonus, but he also got nationally recognized through the whole, big company. And I know how much, even as a young child, I still remember how proud he was of that.
Absolutely.
And so I just think that, it not only impacts the employee, but their families and maybe, their coworkers. And so I think it has more impact than just directly for the employee, but kind of those around them. And so I just wanted to comment on that, because I think they go home and say, look, and then other people think, wow, so they thought my dad was really cool, and they took his idea. And so I think it kind of ripples. So I want to just comment on that, because I still remember very clearly being like 10 or 12 and how proud he was of that.
Oh,
So.
absolutely. And I think, we have folks that do incredible work that have been around for a very long time that have good ideas, but then we have brand new folks, their first time in the job. They think a little differently than I do, and they have meaning, and they might come up with an incredible program that we never even thought about. And this Empower at least gets that kicked off and started. So very excited about that. So just to continue about our fabulous employees, I want to talk about a couple of things. Jill, myself, and Alexis Ongley, who's an assistant director from Community Corrections, we flew out to Tulsa, Oklahoma, for a conference for AJFO, which stands for Association for Justice Involved Females and Organizations. It was about incarcerated females and how we should be maybe looking at justice involved women just a little differently. And so we went out there specifically to kind of learn more, to bring that back to Larimer County and to our new women's facility, about how we can really look at peeling back the onion on women that are trauma related that come into our criminal justice system. And it was a very beneficial conference, made some really good connections. What I did find out is that our rate per capita of individuals who are incarcerated females is very low compared to other parts of the country. In fact, Tulsa, Oklahoma, but Oklahoma itself, for 30 years, was the number one for most incarcerated women in the world and in the country. Now they're third. Idaho is number one. But when you look at Colorado, we are way down on the totem pole, which is a really good place to be. We also have Community Corrections had a Community Corrections Conference in Denver where 3 different sets of staff gave presentations and really represented our Community Corrections up here in Larimer County very, very well. It was, we had a board member present as well. We had Alexis report on gender responsivity, and then we had Misty and her folks also do a training on It Takes a Village when you're talking about dual diagnosis, mental health and behavioral health, and substance use and criminal justice, and they did an outstanding job, and that was just a few months ago. And then we also want to thank you all for our trauma counselors. So our first responder trauma counselors has been absolutely invaluable. We've had 4 debriefs, which means we've had 4 major incidents that affected our staff where they came in and actually sat down, brought their dogs, had the opportunity to really have a conversation and help us get through some really trying times. We still have many, many reach outs. They're going to have a new app so folks can just touch the app on their phone and they can get it connected to the counselors or the peer support that they need. So that has just been a life changer for us, and I think very supportive of our staff because we have to recognize that what we do is difficult. It's okay not to be okay. And we're going to have that every now and then. So it's been very beneficial. The other thing that we're working on, and again, this came from staff, is a workflow project with Smart Sheets to do different types of onboarding and offboarding for not only our new staff, but our volunteers and our contract workers. We're hoping that we're going to develop this great process that maybe the whole county will take the initiative and follow our lead in that, because it's pretty amazing where we'll have a Smart Sheet where an individual who's coming on campus will fill it out, and then it directs to all different people, so it'll say, well, Lorenda needs to do this, and you'll get a little reminder that you need to do this, instead of having emails go back and forth and think things get slipped through the cracks. We're hoping to work with HR and IT to try to pull data so that we're not doing it 3 different times, and I've talked to Mark Pfaffinger about it. So that's one of our projects in the future, but that started that we really want to make sure who's on our campus, because at times during COVID, we didn't know who was coming and who wasn't. So now everyone on our campus has to fill out one of these forms that directs them how to onboard, whether we need to run someone's criminal history, whether we need to do it 3 years from now and we have a tickler that says it's time to run their criminal history again. Have they had PREA guidance training at this point in time? So we're really excited for that workflow project. So, just wanted to talk about the fun things that we do because we do hard things all the time. So, although this is not 2023, we're kind of doing a year in review, so we're going to talk a little bit about December, but this is our holiday party. Not only do we have a holiday party for each division, but we have one, a luncheon. And it's been fantastic to bring both sides together, both ASD and Community Corrections. This was our baked potato bar, but it was very well received. People look forward to it, and it's just, we're excited. Our next one is next week, so if you're interested, I'll send out an invitation, but it's really fun. Obviously, we're incredibly proud of our all-women's facility. People have been calling and asking for tours, and we're very excited for that. So just kind of wanted to bring that up. That was in May. It seems like a long time ago, but it was just this year, so we've been very, very fortunate. And I must brag just a little bit, because this is the only time in my life I get to brag. But Dazed and Cornfused won the cornhole tournament, and usually I have never won a game. So it was a fluke, but Brian Schussler and I were the champions, and then our toilet bowl champions, which is our loser's bracket. I don't want to say that, loser bracket.
You just said it, sorry.
Consolation bracket, excuse me, was the Bilbo Baggins. But this is something that we started probably 3.5, 4 years ago, and everyone looks forward to it. People don't take vacation days because they need to come play cornhole. And it was really, it gets quite intense, absolutely. So that was a good year, I'll just say. And then we always have our staff barbecue where Tim, Jill, and myself serve all of the staff to say thank you for such a great year. It's a great opportunity to see both CJA and Community Corrections sitting at the same table together, laughing, having a good time, and it's just been a great tradition that we want to keep going moving forward.
I do have to say, Tim does not maintain any arm hair during the grilling because the fire gets so hot, and he's a champ, and he's done it every single year, and
Sweating buckets. I would not want to be in that
I
role.
believe he's listening right now, so thank you, Tim.
Thank you, Tim. And I also want to talk about our Veterans Breakfast this year, and I'm going to probably look to you, Commissioner Stevens and Commissioner Shattuck McNally, but we do this every year, and it used to be that we would just honor the veterans that were in community corrections and staff that was in community corrections, but we've really opened it up to all of CJA. So we have many staff from both buildings, from AIM and Wellness, from ASD, from community corrections, and then we also have clients. We had a board member, if you can see up on the right, she's kind of in the brown sweater, and she said you really couldn't tell the difference between the clients and the staff. And that was very exciting and very cool. I don't know if you want to speak to it. I wasn't there, I had COVID, so I had to miss it, but.
I think we came at different times. I came and we actually stood around and talked for a long time, and it was really powerful conversations. And yes, I would agree. You could not tell where everyone. The only thing that mattered in that room was everyone had been someone who had served and was a veteran, and that's the only thing we talked about. And they just talked about how at this breakfast or just this time was meaningful, just to have a chance to be together and be. Have something to go to. And so I think it was really impactful. And for me, after being in the morning reading the names of the fallen at CSU for a half hour, and then coming over and having, a breakfast burrito with all those folks, and then sharing my experience and talking about it, it was just really an opportunity to have conversations that may you not have otherwise unless you had this specific kind of opportunity to bring everyone together. So I think it was really impactful and meaningful. I found it, I was just very honored to be able to attend and come hang out. I don't know what Commissioner Stevens wants to add to that.
Yeah, so this is my third year going, and so we got to have breakfast together and breakfast burritos from Consuelos, which are never bad. Yeah, I mean, I guess, it was really nice to hear everyone's stories of where they served and how long they served. It was, it's a point of pride for a lot of folks, whether people who work there or people who were in ASD or in community corrections. And, it's nice for people who are going through a difficult time to kind of remember that they had a time in their, a time in their life when they were serving, and that was good. And it was, I think they all looked back on that time fondly and the relationships they built there. And I think that's, I think it's just a great reminder of, how important it is to serve and how you can look back at that time and kind of, if you're looking to rebuild your life, you can use that as a, kind of starting off point of, hey, I did this good work in the past, and this is, my future looks bright as well. So I really liked the hopefulness about it and just really hearing people's stories. And we had, Tim's dad was there too.
He's right there on the right, which is fantastic.
Right, and so we had people that, had, served all the way from, he had served in the early to mid-50s, and to people who had served, very recently. One gentleman who had served in Vietnam, who was pretty tearful about the time that he had served and, had been through a lot. And so, yeah, just really heartwarming, really nice breakfast, really nice conversations, and just a really nice way to get people together and thank them for their service.
Gonzalez.
Thank you. The only thing I would add is, within reason, if you can inform us well ahead of time, that would help, like even the upcoming event next week. I'm sure we would all like to participate, but I have a feeling our schedules are pretty packed. And I think on this particular day, I had already scheduled, when I did the reading of the Fallen, it was kind of in the middle of and so that made it difficult for me to come, and I would have liked to have come. And then I think I had scheduled a couple of one-on-one constituent meetings the rest of that morning.
That's
So
completely fair.
as much as you could let us know, well in advance, it helps.
Absolutely.
Thank
We
you
will.
so much.
Thank you. So part of my job is the criminal justice planner. So I want to talk a little bit about what we've done in that aspect. And so this is kind of is a perfect segue because we just talked about our Veterans Court breakfast. But I want to talk about that we're getting closer and closer to our Veterans Court. And the goal is to have a Veterans Court by the end of next year, and it's really coming into play. But I wanted to show you why. If you look at this, and I have 2022 numbers, but they're pretty consistent from 2019 up forward, about how many bookings we've had in the jail, which is 9,918 bookings. 548 of them were veterans. 14 were active military bookings, but what's really shocking is if you look at 57 bookings, they came in twice. So 57 times, and they came in twice. That means we definitely we're missing something, and we really need to help these folks. We've had 2 individuals that had 8 bookings. Wow. And we've had 12 that had 3 bookings, but we've had 57 that have come through our doors twice in a year. It just kind of screams that this is the right thing to do to have our 6th specialty court. So I want to tell you that we were very excited. We have a core team that's kind of getting ready to create this Veterans Court. And the state put on a Veterans Court Symposium in November, and they allowed our team to go even though we didn't have a team. So we were able to be around other veterans courts across the state to really gather information about how to work things forward. Had some incredible speakers, and so we're very, very excited about that. And we have a retreat on December 11th so that we can sit down and really start planning about what is this going to look like, who is going to be the stakeholders, who's going to be the core team around it. And Michelle Bird, again, I keep utilizing her. She's going to facilitate that so everyone can properly participate in that retreat. So it's coming.
Let me just say real quick to give you guys some kudos, and I know that many people are involved, including Chief Judge and others are really critical partners, but the State Attorney General Phil Weiser last week at the County Commissioners Conference, in one meeting with all the I think the 11 biggest counties in the state, gave us 4 separate shout outs as Larimer County. It was kind of a little comfortable in the same hour, but one of them was someone had asked about, hey, we want in our county want to start having these specialty or a wellness court or something, and he pointed over to me and said, you need to go talk to Larimer County. They have 4 different courts. They're doing a phenomenal job, and you need to go see what they're doing. And they also mentioned some of our other criminal justice attorneys and things. And so I just wanted to let you know that a lot of folks are noticing and talking about the work we're doing, and I just wanted to make sure you knew that you're that program and some of the things that we're doing there are special and unique to Larimer County. We're getting some statewide recognition, and I'm sure he's talking about it nationally. So just wanted to share that with you.
Thank you. So I want to just kind of recap of our 3 warrant clearance events. They go over a year's time, but our last warrant clearance event, which was at the Timberline Church, we had 38 total warrants cleared, and we served 34 people. That was significantly lower than the others. What we kind of determined is it could have been the location and not close enough to a bus route. But we did a tremendous job for the folks that came in front of us. And so for this slide for you moving forward is to just give an idea of the collaboration that we have between our community members and our stakeholders that are criminally justice involved. Just incredible folks that are coming out each and every day to help these folks. But of the 3 warrant clearance events, we tallied everything together. So of the 3 events, we cleared 223 warrants, and we helped 161 individuals, and we only turned 13 people away that didn't qualify. So this is just a great slide when people are starting to do this across the state, that it is successful and it's been very promising. Just a couple things. These are some of the exit surveys where it says it was a very enlightening experience. I felt like a human being, and by the people who have treated me unfairly in the past, I'm almost proud of my city of Fort Collins, is what they said. And basically said, I haven't had people have been proud of me in a long time. It feels good to have people be optimistic of me again. I feel hopeful for the future. Another one said, what a blessing it is for a program like this, for me to set things right. I'm grateful that I am back in good standing with the law. And this event is amazing and life-saving. So just an amazing time. I will tell you, we had more than one person fly in for the event. We had an individual that had a warrant that was 13 years old. She was very addicted to drugs and had cleaned up her life. She has 2 small children and 1 on the way. She wanted to get a job with Department of Human Services in another state, but she couldn't because of this. She came through. And they dismissed the case, and she started to cry because her life is now changed and she can go back and start over. We had a Spanish-speaking family come in that did not have a warrant issue. They wanted to go through every one of the community resource fairs. So our interpreter, Ben Rocha from the courts, walked that family through every booth and explained every service that they provided. They stayed like 2 hours. So what an impact that makes. Absolute impact that makes. And then we had another individual that came in that was not able to clear her warrant because it was municipal out of Loveland. But Angela Priest, who's part of our pretrial, recognized her voice and asked her, "Can you tell me your name?" And she said, "You know what, I've been thinking about you for the last 20 years. I wondered if you were still alive." Angela had supervised her on 19 active cases, and they had a conversation, and she's 10 years sober. She's never had a license before, and she wanted to drive her grandkids around, so she said, "Can you check to see if I can pay this restitution so that I can get my license back?" We brought her upstairs, and we couldn't find her case, so we sent her back downstairs, and then someone came running down the hall and said, "I found it." So she went back upstairs, she cleared all of the expenses that she needed to pay, and she started to cry, and she said, "I now can get a license," and everyone started clapping. So really really good opportunities for folks, and they're not afraid to come through our doors. And I actually got an email yesterday from somebody in the community, "When is your next warrant clearance event?" So, very exciting. Want to talk just briefly about our Juvenile Gun Safety Coalition. Doing really well. We continue to work with our school districts, trying to get the message out about safe gun storage and responsible gun ownership and really taking care of our kids. We've tabled many events throughout Larimer County, including doctors' offices, schools, and the public, disseminating rat cards about how to talk to your kids about safety and gun storage. We have given out over 10,000 gun locks since we started. I just got a request for 500 last week, so I'm going to be delivering those this week. So we are very fortunate to continue that message going out. And we also just had a retreat here in the Lake Loveland room on November 28th, because originally our focus was supposed to be on kids that were getting themselves in trouble with guns, and we kind of gotten away from that. So we want to bring that impact of crime class back. So we're hoping to find a venue and some resources so that we can bring that captured audience, the kids that are on probation, maybe going down the wrong path, and really helping them understand gun violence and what it means for our community and their lives as a whole. So that's kind of where we're at with the Gun Safety Coalition. I appreciate you allowing this to fall under Larimer County. It's been very beneficial. And the fact that we've given out 10,000 gun locks, if we even save one person's life, that's pretty tremendous. So. I just want to talk just briefly about our CJAC, which is our Criminal Justice Advisory Committee. That is all of law enforcement, the heads of all of law enforcement. Lorenda is on that committee, as well as we have behavioral health. And we really focus on trying to keep our jail population down by doing collaboration amongst all of these stakeholders. And a couple of things that we've done this year is we created a CJAC subcommittee for grants. What we were finding is that everyone was writing grants in their separate silos, so we were actually competing against one another for basically the same goal and the same purpose. So what we've decided to do is team up together, have meetings, and say, "Do you want to write this grant? I want to be a part of that," so we co-write the grant, so we're more competitive. And that happened because of our CJAC entity that we have. We also have our subcommittee for pretrial, so that we're making sure that all of the stakeholders are together determining how bonds work and how we're going to move forward. We're also working on a video next year about how the bonding process works, because oftentimes people say, "Oh, the jail let these people out," or "It's this person's fault, it's this person's fault," and they really don't understand the bonding process. So we're going to be doing short vignettes of each department and where their role comes in with bonding, and how the impact that they make in their respective agencies, and how the bonding process works all together, because some folks are not understanding that process. So that's something else. We also are looking to do data sharing. We wrote a grant, but we're not successful with this. We want to get a software. We were looking at a software called Gelada. And what it is it's a program where folks can put individuals that are contacted, whether behavioral health or law enforcement, into a system, so that if someone from Loveland contacts an individual with mental health crisis and their criminal justice involved, that we will know about it on the other end, because right now we're not communicating with one another. So if we can get them tied to resources or know they have a case manager, that law enforcement can call the case manager rather than taking them to jail. The software is very expensive, but that's what we're looking to try to do.
Curious, how much was that software?
It was going to be roughly about, for the first year, about $85,000.
And did you apply for impact grant with that?
We didn't. We applied for a different grant. It's not that one, though.
Okay, because I'm just thinking that might be an interesting intersection between criminal justice and behavioral health.
And it even would connect to DHS.
Yeah.
So that it would, all of us would know about this person and it's basically their history through the system and all the different avenues that we can help them through.
That, just to give you a heads up, that, because that doesn't not only go to nonprofits and NGOs, but also other local governments and other things that's open. And that cycle starts in January, just to
Okay.
give you a heads up. So just an
Perfect.
idea, just thinking that might be some useful data for everyone. So thank you.
I appreciate that, and I might reconnect with you later. The other thing that we've talked about is Longview is opening. So that also is part of CJAC, is reducing folks from coming into the traditional jail bed days. So we're really excited to have that on board. And we have new members to our CJAC committee. We now have Sheriff Fain. We have Loveland Police Chief, Chief Duran, Under Sheriff Shellhammer, and our new public defender, which is Ashley Morris. So really excited to have new folks on our committee as well. And we've been consistently collaborating since 2007. It's really important that other jurisdictions don't have this. Weld County used to have a CJAC, and then during COVID, they disbanded. And so then you have a tendency to go back in your separate silos because it's just natural. So we have this ability not to do that, which is exciting.
Emily, can I add here, as a member of this group, when I first walked in, I didn't know what to expect, and it is impressive the way that they can advocate for their own role inside the criminal justice system and also hear each other as they talk about opportunities for improvement. They have the best discussions and debates, and Emily does a great job kind of leading, facilitating these discussions and asking questions with real curiosity about how we can do better. I think this is really unique to Larimer County. It's one of those things that makes our community different and special. I think it's why Emily and Jill and Tim's work is so valued, is because the system talks. And so I really want to congratulate you, not just for having the meetings, but really making them meaningful and having difficult discussions where people can disagree. I recall when we first talked about warrant clearing, some of the law enforcement folks were a little bit uncomfortable with that concept. But they trusted it because they trusted the people involved, and now we've done it 3 times. So that's one great example of the kind of work that comes out of that kind of collaboration.
Appreciate that. Thank you. I'm going to finally turn it over to Jill.
No, I did indicate I would like to see our retention rate increase. I want to point out that in the middle picture alone, we've got about 40 years of alternative sentencing experience in that picture there. So I don't want to give anyone the wrong idea, but I would like to see our retention rate increase. But we have fantastic dedicated staff members that have been there for many years as well. And then just I actually want to go back to the picture really quick. I do want to talk about some things that are unique with some of the staff members in the picture. So you see Chris, he's in the bottom left picture. He's to the right of the coffee maker, waiting to get some energy going in. He started out with line staff with us in alternative sentencing. He moved on to Loveland Police Department, and he realized that police work wasn't necessarily his thing. He came back to work at alternative sentencing and is now a business analyst within criminal justice services. Community justice alternatives. It's been a year plus now, and I should have it. But I do want to point out that I think we have a lot of valuable staff members who have taken different journeys and then come back to us just the same too. So I enjoy giving that little fun fact about Chris there. I want to give some higher level information about how things have been going in work release to date in 2023. So we have an 85% successful completion rate for our work release program, which is significant. Of the current population work release, 81% of them have stable employment within our community. And to date, we've saved over 28,000, almost 29,000 days over serving them in Larimer County Jail. So essentially, we would be saving the county about $2.3 million based upon those days served in work release, based upon that $95.95 figure over what the jail charges as well. So that's been a significant savings to our community, even with our numbers being down. Going on to the work in our midweek program, 82% of our work in our midweek clients have successfully completed the program. That number is less than work release, but when you think about that this is an intermittent jail program, they come in 2 days a week and they're out in the community the remaining 5 days a week. They come back to us repeatedly. So to have an 82% successful completion rate for that type of program, I think is fantastic. We saved 3,100 days over serving those days in the jail, and that's a savings of about $250,000. And most importantly, our client work crews have provided nearly 18,000 labor hours to 36 nonprofits within Larimer County. So this is the program that We struggle with our numbers significantly in this program, but big picture, we still look at the community and the give back that we give to the community through that program, even with decreased numbers, and it's still a worthwhile program to have in our community. Commissioner?
Commissioner Gonzalez.
Thank you. Just had a thought. Would it work at all logistically and risk-wise if someone like myself could do a ride-along on one of these when they go out and do,
Absolutely.
get on the bus,
We would love to have.
pick up trash, or?
Yes,
Could we think about that for next year?
Absolutely.
I've been doing a few ride-alongs here and there, and it just dawned on me, this one might be more than interesting.
I've seen you up at Horsetooth a few times, so I know you get those done up there. Yeah, we'd
So
love to have
we
you.
all consider that? if
Absolutely.
We can do it properly? Thank you.
Absolutely. I want to talk a little bit about our alternative sentencing case management. So this program is focused to our work release population. When I say it's fairly new, it's about 13 to 15 years old. And we are making improvements year after year after year within our case management program. First and foremost, we want to make sure that all of our case managers are touching base with clients within 5 days of entering the work release program. And that's really just to sit down with them and make sure that they have everything set for their release. Now, keep in mind that our average work release sentence is about 45 days, so significantly less than what you're going to see in community corrections. So we have a shorter turnaround time to make some of these corrective actions if needed, as far as founding housing for them when they get released, making sure that they have employment within our program, and any other needs that may need to be met within that period of time. We do have sex offenders that are in the work release program, and we have one case manager that works specifically with that population. Now, they have a very high, they have a lot of rules. I'm trying to figure out a better way to say that, but they have a lot of rules to follow within probation specifically. They have to register, they have to follow the sex offenders' terms and conditions within probation. And we have one case manager that focuses solely on that to ensure that they're being compliant with that and that they're safe within our facility and within our community. Another thing that we've been doing significantly within the 2023 year, which we haven't really done in the past, is referring our alternative sentencing clients to our STIRT program, which is a short-term intensive residential treatment program in community corrections. And I should have put that in there, I apologize. So sometimes we will have a client that is really suffering with their substance use disorder and having a hard time staying sober within the community and within our program. And while we would normally revoke that particular client to jail because they've consistently violated rules of the work release program, we work to have them actually enter STIRT instead. And we've had about 7 clients so far for the 2023 year utilize that as an option instead of revocation. We also have worked to have 25 of our work release clients get on medication-assisted treatment, otherwise known as MAT, after beginning the work release program. And then another thing, which is pretty new to us, and like Emily was talking about initially in the intro, this is just something we've never really considered within work release before, which is offering incentives to our clients for doing well within the program. We would have never have thought 10, 15 years ago to offer a gift card to Walmart for a client who's being compliant in programming, who's going above and beyond in the program. And that's a step in a different direction that we've been taking with our clients so far. We've had 19 clients that have been recognized with gift cards at alternative sentencing, but we also give them other handwritten cards of encouragement as well when they are doing well. Useful public service, and I have some things to show with this as well, but I'll go over some numbers first. So we've served over 1,500 clients in both our Loveland and Fort Collins offices. They've come in for interviews to get new agencies and to be set up with their community service program within our community. We've had about 1,500, a little over 1,500 clients successfully complete their court-ordered hours, and we've given over 90,000 hours to our community through useful public service. And we serve 65 nonprofit and tax-supported agencies. Now that number's gone down, that 65 number has gone down significantly. What's sad to say is that COVID really impacted the nonprofits within our community. We have a lot that simply aren't around that we were providing services for before, but we are working to get that number back up to make sure that our services are available to nonprofits within the community. And Commissioner Shattuck McNally, you were talking about specialty courts previously. We do often serve folks in our wellness court, family court, DUI court, drug court, and juvenile drug court to have community service hours done for sanctions within those specialty courts. And then I want to talk about some additional special projects that we've done. In April of 2023, we worked with the Museum of Discovery to complete 300 projects for their summer science outreach program. This summer, we worked to complete 1,500 projects for Fort Collins Library summer reading programs. And then currently, we're also working on over 900 projects, which I think is crazy that we're going to be able to get them done, but I'm super excited about it because it sounds like we're almost there. But we're working on projects for Fort Collins Library's winter program that are supposed to be completed coming up here pretty soon. I did want to point out, or bring, show and tell, some different projects that we've had in previous years. So this one right here, you guys can't see it, but it has like 1 cent, 10 cent, 5 cent, 50 cents, and there's some with dollars on them. And these were created for kids specifically during COVID to help work on math skills and money skills while they were at home. And then we also have some winter projects, like this is a penguin. Then you use a paper plate, and the community service client prepares all of these packets. So we give them as many materials as we have on hand. They may need to purchase some additional ones, but they're given a certain amount of hours for each one of these projects that they put together. So it has been very beneficial for our community and a little more out of the box versus going to the fairgrounds, and not that there's anything wrong with it, but shoveling horse stalls for a day, which is another option that we have. But this offers, it's another fun option, but this offers some different alternatives for community service projects.
So the next one that we wanted to talk about for community service was we partnered with Alliance for Suicide Prevention. And they have, I think it's their second or third year that they have done the Teen Self-Help Care Fair, which is at the Discovery Museum. And we've been blessed to be participants in that, and we've given them care packages as they leave. And I will tell you, they're outstanding. So I brought a copy of them, but each child that comes through the Teen Self-Help Care Fair gets this, which is the ability to journal with their own pen to journal. They have the ability to get friendship bracelets. And then what I think is the coolest thing here is that they have affirmations that says, I am worthy. I'm going to have a good day, that they are encouraged to look at every single day. I happen to be working the Juvenile Gun Safety Coalition tabling event there, and I had kids come back screaming, going, you've got to go get the gift bag, you've got to go get this, it's so cool, it's so cool. But it is very impactful so that when they leave, because they're taught about really taking care of themselves and journaling, and to give them that opportunity for a beautiful journal and to walk away with this, they were just so appreciative. So we have pictures of the care package there. But what was really nice is they put us in their newsletter. So Alliance for Suicide Prevention put this quote in there. But I want to read it for you because it's really impactful, because it's not only the children that receive these gift bags, but it's also the folks that had to create them as part of their community service project. Many of the community service clients that signed up for the Teen Self-Care Bag Project were deeply moved by having the opportunity to complete their community service in such a way. One client was overcome with emotion when I presented this project opportunity to him, as his family had been affected by suicide with the recent death of a family member. Several clients also mentioned that they even made extra bags for their own teenagers because of their strong belief in the mental health benefits of journaling and daily affirmations. So it kind of worked both ways. And they were so grateful, just absolutely so grateful that they were a part of it. And I wish you could have seen when you walked in and saw all of those, the kids' eyes just got huge. Like, I get to take this away from me. And it's, sometimes you go places and you get things that you throw away. This was something that they definitely wouldn't throw away, so.
Do you care if I talk about the Santa Cops toy thing?
Go right ahead. Yeah.
So you guys probably have all heard that Santa Cops is no longer going to be in existence. Alternative sentencing, UPS specifically, has always had a very strong tie with the Santa Cops program. And throughout the years, we've really focused on offering community service projects to folks that may be skilled woodworkers, and they have created some amazing projects for Santa Cops. I think throughout COVID and a little bit before that as well, when they were having a hard time finding storage space, they demanded less and less of our projects. So we were giving out less wood projects as time went on, to the point since COVID has happened, we really haven't been focusing on those for projects. One thing that we will be changing within 2024 is that the UPS program will be bringing those wood projects back, and instead of just focusing on Santa Cops, we're going to be creating an internal board that will pick a nonprofit agency within Larimer County annually. So we will be working on craft sales, working with that nonprofit to see if there's any woodworking needs that they have. So it's really still bringing back the spirit of Santa Cops, and allowing those clients that maybe have not been able to do community service hours with their incredible woodworking skills to be able to bring that back and kind of bring back the spirit of Santa Cops to another nonprofit agency, which I'm extremely excited about, and I think our staff is really excited about that as well.
That's great news. And I know there's that secret, NOCO secret Santa or whatever, Samaritan group in Loveland that's been, I think they just posted a picture where they went and bought a bunch of things at Walmart and they're doing, so I don't know if that would be another connection.
Excellent. NOCO secret?
I'll look it up and again, but they, I don't know who's all in the group because they try to keep who's involved secret because they just want to do it out of the goodness of their hearts. But I will, I'll look for that. But I know that, it was sad to see that happen, but I think there's a lot of organizations that are trying to pick up the slack, but there might be different areas throughout the whole county. It'd be interesting to see how we can, connect them all or support them all, so.
And I will tell you, so my kids have been participating in Santa Cops since they were about 5. We would go rap, and then I also had the opportunity to check people in, and I cannot tell you how many families came up and said, I'd like the wooden toys, and they kept talking about the wooden toys, because it's historical that we have provided just incredible, like rocking horses and baby cribs and little things like that for the kiddos, so we're really excited to bring it back.
Emily and I are going to tag team on the slide a little bit. But first and foremost, pretrial always has been and will always remain very busy. And you can see that by the first number there, which is the number of bond applications that have been sent to the court. And I have no doubt that since these numbers were provided and put in these slides, they've gone well over 6,000 bond applications sent to the court. Another big number to keep in mind here is the bonds that have been set pre-advisement. So as you all know, all of our pretrial staff are sworn bond commissioners, and they have authority to release folks prior to going to their court date in order to help alleviate the jail of some extra folks in the jail from time to time. So they do have to fit within a strict criteria in order to be released, but we have released 882 folks since January of this year. Cases ordered to pretrial supervision, always huge, over 6,500. That may have gone up to closer to 7,000 by now. But you also want to take a look at our total cases closed. So we're bringing in and closing the same amount of cases for the most part, so that number is remaining fairly stable. So Emily, I don't know if you want to talk about some of the MIPS or...
Yep, so when someone comes to the jail, we always do a mental health screen. They do that for the medical staff there, but they also do it for potential pretrial. So we did some mental health screens for over 5,000 individuals that came in this past 11 months, and about 1,700 met the criteria. Now, it's a voluntary program, so 356 individuals took advantage of the MIPS case manager as part of pretrial. But what's important with that is not only do we make sure they're coming back to court and not reoffending, we're connecting them to resources. So of those 356, we made 1,848 connections to community resources as a condition of their bond. Some jurisdictions simply aren't doing that, and we're doing that consistently. We also have our competency clients and our bridges clients, which are folks that are raising the mental health issues of whether they can proceed to go forward, connecting them to resources as well. And as you can see, our competency, we've given 452 connections to resources and 423 community resources for our bridges program. What's absolutely appropriate to talk about and so exciting is we've had pretrial for 48 years. If you look at all of the defendants that have come through in the past 11 months, or 10 months, we've had 60,605 court hearings that we need to make sure that people are getting to. Not all of them are our responsibility. 29,107 are our responsibility. But if you look at the failure to appear rate, pretrial, those under supervision, is a 5.5% failure to appear rate. Folks that are not supervised, 16.3% failure to appear. So what we're doing is working, and it's really exciting, and we're very, very proud of our staff. I want to talk a little bit about our competency. This is the one thing that we do have folks from across the state calling us saying, we want to be like Larimer County, we want to do a program like Larimer County. And so I want to just give you some stats that you can share with other community members. But we began in 2021, in May of 2021. And past participants served in 2023 alone. We've served 105 individuals in our competency docket. Of those 105, 46 remain in custody but are still giving services, and 59 are out in the community. That number would probably be so much higher had we not had the competency docket. Folks would be languishing in jail waiting for a hospital bed at the Colorado State Mental Health Institute of Pueblo. So in the past, since 2021 when we began, the past participants are 220, and we've served over 329 individuals on our competency docket alone. What's really amazing is since 2021, we've dismissed 209 cases. Those are individuals that did not need to go further into the criminal justice system, that had mental health issues that were connected to resources. This year alone, we've dismissed 117 cases, and that's because of the partnership that we have with the public defender and the DA's office and our competency case managers and team leads, really supporting that individual about what is the right thing to do for this individual. Is it to continue with prosecution, or is it to give them resources so they don't return to us? So that's been fantastic. And again, when you're talking about services, we provided 412 services to the Bridges individuals and 459 to our competency. The services that we give are basic needs. We give out tents, we give out coats to keep them warm, we give them food, we give them phone cards so they're able to connect with folks. We give them medical and behavioral health connections, communication, like I said, with cards, minutes for their phones. Transportation, we take them to and from appointments that they may have, and we help them get vouchers for housing. So just incredible programs that we do. And again, we're looking to, and one of our future things that we'll talk about at the end is having competency beds at ASD. ASD has room, and so we'll be writing some grants to figure out those folks that maybe are homeless, so they cannot come out of jail and support themselves in this competency process, but could they stay with us? Could we go out to Summit Stone every day and give them resources, get them housing so that when they're ready to transition out, they have somewhere to go and that they don't come back into our system? So Mesa County does competency beds. They call it the Precaps program. We've traveled down there to visit them. Our goal is by next April or May to have a few beds slated for ASD for that very population. Yes.
Commissioner Stevens.
Yeah, I have a question. So, when you're talking about people who are unhoused, I mean, how much do we feel like that contributes to, I don't know that there's a way to, numerically kind of state this, but I mean, not having a place to live and maybe being with a crowd that, whether it's access to drugs or being around other people who might be more likely to commit crimes. I mean, what does having a home mean, like, for these folks? I mean, is that can be the difference between people really about recidivism and stuff like that? Are there any statistics that we have, or do?
I don't have those, but I could tell you that I absolutely agree that not having the stability of a place to have a roof over yourself is not going to make you want to come to court. It's not going to make you want to finish your criminal case. And so that's a huge thing. And that's why with our aim and wellness, with our competency, trying to give them basic needs to get them through, but then also get them connected to Housing Catalyst and the Murphy Center to try to get a voucher for them. But absolutely that contributes to recidivism, because they don't have the stability, they don't have the comforts that we have, they don't have the food, so they may steal and to get their basic needs met. So absolutely, and the housing crisis is a huge thing to tackle, but we definitely want to be a part of the solution to that.
Thank you. It just reminds me, you're telling us all the things that you do on your end, but some of the things that we need to work on our end. And it's certainly something that we're all cognizant of and we've tried to work on. But, and it's tricky because we're just, there is a housing crisis, but just how important it is to really the health of our community.
What I will tell you is that I believe that I could say this wrong. It might be Homeward Alliance. They're writing a grant for the competency docket to do case management for housing. So it would be a perfect kind of marriage with us if we're having them come from us to ASD for a period of time, connecting them so maybe they have the ability to get a voucher while we're doing this in the middle part of it. So really trying to collaborate with them to try to connect these folks.
And then I know we and others are working on, now having a voucher is great, but having somebody who will take your voucher is also important.
Exactly,
So
100%.
And that's something that we can do through through our office, and I know that Neighbor to Neighbor and others work on that too, is that outreach to landlords around, offering them protections, I think, because there's some nervousness around taking a voucher, I think, and what will happen if that person doesn't pay their rent or does damage to the apartment or something like that. And so I think that there's a lot of that work that needs to be done too, but
Absolutely.
thank you.
So we want to focus on some of the great programming that's happening at Community Justice Alternatives right now. Emily had mentioned in one of the first few slides that we had attended a conference in Tulsa, the AJFO, which is the Association of Justice Involved Women and Organizations. And one thing that was really brought up repeatedly in most of the sessions we attended is the importance of peer support and lived experience, both as a connection for the clients in your care, but also for the staff involved. And one thing that has been really on the up and up within the CJA programming is utilizing those peer support programs. So currently we're working with 4. We're working with Northern Colorado Health Alliance, NAS Recovery, which is Nap and a Sandwich Recovery, Yarrow Collective, and Break Free Recovery. We are working on getting these different groups into our program on site in order to offer some different alternatives for our clients as well, because Nap and Sandwich may not fit a specific client, but Northern Colorado Health Alliance services may. So we want to make sure we're offering a good variety and allocating them appropriately and equitably within our program to make sure that everybody has an opportunity to number one, receive these services, but also for those agencies to provide those amazing services. I want to focus a little bit on the gender-responsive programming that has been added since the opening of the facility. And we have the names and subject matters of a lot of the groups there. And we have relationship series that are going on, the Support, Encourage, and Empower Develop, which is the SEED group. We also focus on women's life skills groups, grief and loss groups, writing classes, and you'll see that on the men's side as well. Parenting classes, and Vintage Women, which is a recovery support class specifically for women in our care. And then these programs listed on this particular slide have been happening for a number of years. And they are both for men and women. We have Speak Out, which is creative writing, recovering from abusive relationships, authentic menhood. We have Bible and religious studies, AA, Room for Hope, Vintage Women, GED classes, which is significant. And then one of my most favorite ones is the Blues Behind Bars. And I may have kind of described this to you guys in the past, but it's when our clients will write lyrics. They'll essentially write poetry, but essentially it turns into being lyrics for a song. And then the volunteer that works with Blues Behind Bars will come in and put their lyrics to music. So it's a fantastic outpouring of, emotion and support for those folks to see their lyrics turn into music. And we had one community corrections client which loved to go around and sing it while she was walking through, and she had a blast with it. So I think it's a favorite for both clients, and it's one of mine as well. Another important one that I think is overlooked a lot is nutrition. We have a lot of people that have not had the best lifestyles as of late, whether it's due to substance use disorders, or just the fact that they may be unhoused and don't have access to easy nutritional foods. But this is a class that offers them different ideas in meal planning and meal making as well for when they are outside of the program. And then we do have some grant monies that are available in conjunction with Colorado State University, which offers food safety certificates. I'm not sure on numbers of folks that have gone through that so far for this year, but that is a fantastic opportunity that we have within our program.
So now I'm going to be Tim Hand and put on my Tim Hand hat, but we're going to talk about community corrections and the fantastic things that they have done this year. The first and foremost is another huge thank you for your support in our remodel. So this is the end of phase 1. If you can look at this, if you've been through there, this is like night and day. What's really exciting is the middle picture up there is a brand new check-in desk. So originally we had a COVID grant for all of CJA, and we had it since COVID, and we were about done with the money, but we had about $95,000 left. So We met with the construction individuals, we met with the group, because if we have 2 check-in desks, it's going to make more space, so it's going to prevent COVID from spreading. So we were able to use that money so that we actually turned in, and I say that Brian Schizler's is in trouble because we gave back 97 cents to the government, but we used like 380,000 of that, to get through. So just fantastic that we had that addition of that new check-in desk when you come. But new paint, new floors, new ceiling tiles, new bathrooms. It is just a facelift that absolutely needed to happen. And then this is phase 2. Oops, let me go back. So phase 2 is where the women's and men's treatment used to be. That'll be done the 2nd week or 3rd week in January. So this is still the construction, but you can just see how we're opening it up. It's going to be so much lighter and so much nicer for individuals that are there, especially for their treatment, and they don't get to necessarily leave like the rest of the folks in community corrections can. So this remodel has been just life-changing for staff and for the clients that we serve. Just want to talk really briefly about our Community Corrections Advisory Board. Very, very strong board in our community, do a really nice job, and they set the criteria of who comes and goes out of the Community Corrections facility. They look at referrals and they look at cases that don't necessarily meet the criteria for staff to make the decision of whether they come in and out. So they are critical as community members, making the decision of who's coming into our facility. And obviously, Commissioner Stevens is our liaison, Tim is the staff liaison, and Alexis also runs this incredibly well. So just kind of wanted to give you an idea of who is on that board and the significance that they have in it. Lorenda is also on that board, and you review cases on a quarterly basis, and it's very eye-opening to see who we're choosing. I also want to show another good picture of the Conrad Ball. It's been around for 45 years. That is absolutely amazing. And Kate Perrell received it this year from the DA's office as a stellar victim advocate, and I can't remember what the service dog is for the DA's office. I can't remember the name. Zoe, is it Zoe?
It's Zion.
Zion, okay, Zion. So Zion was incredibly well behaved and just fantastic. So what a nice night. This is near and dear to my heart. So I have I'm on the Victims' Rights Subcommittee for the state of Colorado. So we hear all of the complaints that come forward for victims of crime under the statutory constitutional VRA amendment. And so we are one of the only CJAs that have an actual dedicated victim advocate. And we have 2 victim advocates dedicated to ASD and community corrections. And we wanted to we always talk about the clients we serve and supporting them as a reentry, but we can never lose sight of the victims and the victims of the crime. And so we want to make sure that they're supportive. So from January till November of this year, we've had 948 victim cases that have come through. And we have 376 active victim notifications where victims we mandatorily opt them in, but they don't necessarily have to stay in if they don't want to. But we are consistently communicating with the victims, letting them know how that person is doing in the program and making sure that they're safe and their needs are met. I kind of wanted to give you a little bit of stats of the makeup of our crimes that come forward that have victims associated with them. And if you can see, obviously 32% are domestic violence cases. And so because of that, we've created a specific domestic violence caseload in community corrections to make sure that those individuals are getting the treatment they need so they don't recidivate and keeping our victims safe. We also have 25% of them are assault and menacing. So again, lots of different things that we need to focus on to make sure that anger is addressed, that future violence is addressed so that we can support victims of crime and make sure that their voice is heard. Also wanted to talk a little bit about the demographics, about the age. So 52% of our victims are between the ages of 25 and 59. And then 15%, which is our next biggest pie, is between 18 and 24 years. So just to kind of give you a little insight of what that looks like. And then we obviously, it's closer than I thought. We have 48% victims are female, and 37% are male, and then 11% or 15% chose not to identify themselves. But again, most of our victimizations comes from the gender of the female population. So what I want to talk about here, we haven't really talked about evaluations, and I'm not going to spend a ton of time on it, but we screen a lot of individuals of whether or not they should come into our community corrections program. And this year, up until November, we've screened 865 individuals to potentially come into our program. And our acceptance rate is 62%. I believe that to go to the board, we've had 41% of those cases that met criteria for full board review, which means they're high-risk individuals that the board has to make a decision, should they come into our community, should they not come into our community. And this is what's really telling. In 2018, 33% of the total cases went to the board, and this year, 41% came. In 2012, only 43% of their LSI scores were 43% of clients had high entry LSI scores, and in 22, there's 60%. So what that means is we are taking higher risk individuals than we ever have had in the past. So that's two different things. We have judges that believe in our programming, that believe that we have the skill set to take this high risk population rather than sending them to the Department of Corrections. And then we also have a board that's willing to take a risk on an individual coming out of the Department of Corrections that other community corrections may not take. Because if they don't come to us, they parole out into the community without services, without access to resources and to therapy and treatment. So it's really critical that the board has the opportunity to screen these individuals to say, we're willing to take the risk. There's some community corrections programs that take really lower risk people and their rates of success are higher, but they're turning away individuals that we've chosen not to. Because if that person has been in prison for 25 years and they're gonna have a hard time adjusting, I'd rather have them spend 210 days with us than getting, a hotel voucher for 5 days out on Mulberry and not having the access to the community and resources that they truly need to reenter successfully. So when you look at this, it's so important that these are complex cases with individuals that have high needs, high risk, high substance use and mental health, and we're willing to take a shot on them. Each of our evaluators spend at least 8 hours on one individual that gets screened so that they can give as much information to the board as possible to make a good decision on who should come into our program. Because we also want to make the clients around us safe, but also our staff members safe as well. These are just some things that we won't get into this because we'll probably do another presentation on how in-depth evaluations are in the future. But we look at a lot of different things before we let someone come into our program. What is their current offense and their past criminal history, their education and their employment, what financial responsibilities do they have, what are their ties to Larimer County? Because there's a lot of folks that want to come into Larimer County that have absolutely no ties, and the board has to make a decision of who gets the priority to come into our programming. All of the living situations, their recreation, their companions, their substance and their mental health issues, and whether they really want to be a part of this program. We're not going to bring someone into the program who just wants to get out of jail. They want to want it because we want them to be successful. This is another thing when we're talking about the risk level. If you look at from 2009 to 2022, our risk level is up in the red. It goes up to 60% because we're willing to take a chance on these individuals and we're confident in our staff that they have the skill set to help these folks in the program, and we're not going to just turn them into a traditional jail bed day.
So I have a quick question on that, if I might. Because we do maybe take on some of these more challenging cases, it's really hard to compare apples to apples with other programs because, so actually we're kind of a, I won't say island, but out here doing things with a great success rate, but you can't really compare because we're taking on challenging cases and still having this success rate. So is there anywhere else that you can align us that we're showing that we're along with these others that we're able to compare? Is it nationally or regionally or any of the other counties? I know we're so unique compared to the rest of the state. I'm just curious, that's a good reminder though for me that not only are we having great outcomes, we're actually taking on some pretty difficult cases.
Well, and what I would say is, even though we're taking on the high risk, high needs, our success rates are near the top. We're one of the 1 and 2 in the state in regards to that. So even though we absolutely need to distinguish ourselves from the others, but our success rates still remain high, which is fantastic. So I want to talk a little bit about the individuals who've come through community corrections this past year. We've had 854 individuals come through our community corrections program, and we call that distinct clients. And why I say that is because some of the residential clients may overlap into treatment, because when they come in, they screen in, and we want them to do both, so we didn't want to double count. So basically, distinct clients, we've had 854 come through our doors. We've had 798 that were residential, and 418 went through our treatment program, which is our ERT, our STIRT, and our RDDT program. And we've also served, that aren't part of this calculation, 231 individuals out on non-residential status. So we have a lot of folks. And remember, Jill talked about ASD, the average sentence between 45 days and 90 days. Some of these folks can be with us for 15 years, and so, or more. And they're out in the community on a non-residential status. What's very exciting that we've done is we've been able to collect restitution for victims of crime. So our residential folks have nearly, so far in 2023, have collected nearly $500,000 of restitution that they're owed. Non-res was $66,000, and then total over $500,000 given back and paying back for the harm that they've caused. And again, part of that is the state has given some subsistence money, so folks aren't paying rent. So we're really making sure that they're budgeting. If you're not paying rent, we want to make sure that you're paying off your court fees, and you're paying your child support, and you're paying your restitution. So that's helped us get more and more restitution back to the victims. This is also very exciting, employment. We really want to make sure that folks just don't have a job, they have a career that's going to help sustain their families. And so we have 151 clients, that's 70% have full-time employment in our residential treatment program. We have 20 clients, which is 9%, are part-time. And then we have 5.5% are on a disability. So we try very, very hard to connect folks to resources and good paying jobs. And I will tell you, a lot of employers really enjoy working with us because we're timely, we're stable, we check up on folks, and they're very hard workers. So we're very excited. We have an incredible employment lab for both ASD and ComCore, and it kind of shows right here. We've helped 225 clients total this year. Again, this is very exciting. We never had a women's STIRT program, which is our 21-day inpatient program. The men had one, but the women did not. It is truly something that we needed, and so now we've opened our 21-day women's STIRT program, which is outstanding, because a lot of folks can't spend 90 days, they'll lose their job, but their job may give them 21 days to come into a reset and a substance use program. So that's very exciting. We really want to focus on continuum of care. So we want to make sure that folks are going from treatment and getting more care as they transition back out into the community. So we're really working with the needs at a higher level of care. People with their weekly outpatient and intensive outpatient treatment using $1352, which is set forth by Department of Criminal Justice, gives us money that we can have folks go out in the community and get treatment, and then we pay for it as they transition back into the community, because we don't want them to say, I can't afford it. We want to connect them to resources, get them maybe signed up with Medicaid, so we're kind of that transition point, and we're able to do that with our $1352. And we continue to start our Medicaid billing. It's still a work in progress. It's been very difficult, but we're not giving up. We've also hired 9 new treatment staff, 7 therapists and 2 interns, and we've trained them for a total of 1,260 hours. So we have great people behind the helm really helping our folks that are going through treatment. This is something that I'm going to speak very high level, but it's very exciting. This is called the Health Services Core Grant through Colorado Department of Health. And basically, they're looking at shortages of employees in mental health, comprehensive primary care, behavioral health, and dental care. And so basically, 5 of our therapists in our treatment group have qualified for this grant. So 5 staff members have committed to us for 2 years, and in a 2-year period, they get $90,000 off of their student loans. And they can do a 3rd year for another $20,000. So it has been incredible. So we have 5 people that are working for us that are on this grant program to get rid of their student loans, and we have 3 more that are in the chute to apply. That's a game changer. It's fantastic for them to get rid of their student debt, but it's also fantastic because I'm hoping that we'll hook them and they'll stay. Because right now they're really enjoying themselves, And I think they might have come so they could get their loan forgiven, but I think they're having a really good time. So we're really happy about that. Here's some of our treatment numbers. So for both men and women between all of our programs, our residential dual diagnosis, our 90-day program, and our 21-day program, we've helped 542 people this year alone. Our women in our 90-day program, our women in recovery, have a success rate of 65.63%, which is outstanding, and an unsuccessful rate of about 34%. Our female residential dual diagnosis, which is a 6-month program with 9 months of aftercare, has a 64% success rate. And our STIRT program that just started in July of this year is skyrocketing with an 80% success rate. And so we have a total of 25 clients there. Our men's program, our 90-day program, has a 68% success rate. And again, we have 85 individuals that have come through our 90-day program this year. Our residential dual diagnosis, we've had 28 individuals come through with a success rate of 64%. And our 21-day men's program has had 116 folks come through with a 79% success rate. And again, if you look at all of our women and men's program, the success rate we've had for our 6-month, our 90-day, and our 21-day is 71.99. I'm going to call that 72%. 72% success rate of 332 clients. That is absolutely outstanding to give these folks that probably came into the justice system because of their substance use, caused them their criminal behavior. Can we prevent that from happening? And I think we're doing a stellar job. Now, our AIM program, which is in Loveland, our AIM and Loveland and Fort Collins, our AIM and Wellness program, these are our most high-risk individuals, our most high-risk, high-need, our most vulnerable. They stay with us for a very long time. So when you see the numbers don't seem high, but it's the intensity of which we supervise these individuals. So our current participants in Fort Collins for our AIM program is 15. Loveland is expanding they're just exploding at the seams with 32. They're at full capacity down in Loveland. And then our wellness court has 27 participants. So we are making a difference in these folks that have significant, severe, and persistent mental illness. Our evaluations, we've done quite a few, 23 in Fort Collins, 20 in Loveland, and 25 for wellness court. Doesn't mean that they're all coming through. A person could decline coming into our program. Our person may not be sentenced to our program. They might have more significant consequences. But those are the evaluations we've done. We've accepted 5 in Fort Collins, 7 in Loveland, and 14 in the wellness court. So if you look at it, that looks like a small number of acceptance, but folks stay with us for a very long period of time. And we want to make sure that our numbers aren't too high, that we can't give the services they need. Because remember, they're getting their medications in the morning, they're getting their medications in the evening, they're getting their medications packed out with them, and they're having one-on-one counseling and group counseling as well. And again, our successful completions this year, we've had 2 in Fort Collins, 1 in Loveland, and 7 in wellness court. And again, the success rate for this population is about 30%. And that's higher than the national average, just because it is such a vulnerable population that has such needs. So it's very important that even if 3 out of 10 don't come back to our criminal justice system, that is a huge win for them and for their families and for our community as a whole.
What would be a national, I mean, you say we're 30%, 30, mid-30,
I can connect back with you, but I think it's like around 10 to 15.
but we're over 30, or around 30? Okay,
Yep.
thank you, that's helpful.
So this is pretty astronomical numbers, but our day reporting center where folks go and get substance use testing, we have in Fort Collins alone done 35,000 urinalysis this year alone, and we haven't even finished our last month. We've done 2,153 breathalyzers, lots of different things. And remember, this is just not our folks that are coming through. This is folks that are on probation, Department of Human Services, maybe they have a case open, and the DHS worker wants the family to come and test. But we've served 4,370 different clients this year, which is pretty outstanding and pretty amazing. We also do federal probation and federal pretrial, so we do folks from the federal system that come in and do UAs and BAs as well.
Yes, please, Commissioner.
So is this adjacent to alternative sentencing for this day reporting center?
So where it's located?
Uh-huh.
So when you look at community corrections, it's really the front door. The front door of community corrections is DRC. So the main entryway is where they go.
And are there some extended hours for that to be open?
There is.
Okay.
Yep.
And it's obviously good because you're on a bus line for all those kind of reasons, right? I mean, for both people getting to employment, people getting to do this, because I know this can be really, I mean, if people can't get in to do this, then they can get caught back up into the system.
Absolutely.
And so this is a really important service to provide, to make sure that, right, I mean, folks could be doing everything right, but if they don't get in and, they can't make it in for, the urinalysis, they can get caught back. I mean, that's the only thing that, I think that in some of these things, they can be really, through no fault of your own. I mean, you can do one thing and you can get, people can get caught up then because of a bus being late or a transportation issue or I forgot or what, half a dozen different reasons, right? Had childcare needs or something like that. So I'm glad that this service exists because I think that there are a lot of people out in the community trying to, stay within the parameters of their probation. And, it's tricky.
Well, and
That's
I
all
will
I'm
tell you,
saying.
so this is an absolute perfect segue. Thank you. You just kind of teed me up for the next slide, which is our Loveland DRC, Day Reporting Center. For the longest time, they did not have the opportunity. There's some programs down there, but they didn't really have the opportunity. And folks that got their color called would have to get on a bus, figure out how to get to Fort Collins and come back, and it was taking 6 to 7 hours. So if you look at Loveland Day Reporting Center from 2021 when we opened to now, it's astronomical about the folks. So 400, in October alone, 468 folks took their urinalysis in the Loveland area. I wonder what percentage would not have taken it because they didn't have transportation, they didn't have the financial means to get up to Fort Collins or to get to the other programs. So it's been instrumental. Same thing with AIM down in Loveland and community service and pretrial down in Loveland. All of those things were never given to our Loveland Estes Park Drake folks, and now they are. And so it's been so impactful. And it would be a shame if we weren't able to provide those services because they're so critical, because just because you don't live in Fort Collins proper doesn't mean you shouldn't get these Larimer County services. Absolutely.
Right, and sometimes a bus route, I mean, if you're having to transfer 2 or 3 different buses, I mean, people don't understand that can take hours
Yeah.
to
Or-
get to a distance that if you had a car or you were able to use a car, would take 15, 20 minutes.
Or do you decide that I can't miss 6 hours of work to do a UA, so I'm just going to skip my UA, and then I'm going to get more in trouble with the courts, and then I'm going to lose my job. So it's just like this cyclical problem, so absolutely. I want to talk, and I know we just had a presentation, so I won't spend a lot of time on this, but this is a very good slide to have in your pocket if you want to talk about our transportation unit. Because remember, the sheriff's department's not doing this. We're saving so much more money and having the kiddos penetrate less into the criminal justice system by having our transportation unit. But if you look at how many hours we've been in court, 402 hours so far we've been in court this year, and we've tracked over 30,000 miles on this. This is so a sworn deputy doesn't have that obligation, and usually they do 2. Remember, 2 deputies to our 1. And it's also important is that the folks that we've helped at the hub, we've spent 708 hours at the hub. That means law enforcement can get back out on the street. They can go help folks, and then we can help those that are needing help at the hub. We've had opportunities where we've sat there for hours when someone was a runaway to try to find them a proper place to be, to make sure that they're safe that night. Law enforcement doesn't have that luxury of spending that much time, but we have the ability to do some wraparound services with our transportation unit. But what's really important is if you look, is that this year we've helped 591 juveniles come through the system in an efficient manner. We've had 1,061 hours just transporting the juveniles. We've supervised the juveniles over 1,100 hours, and we put 37,194 miles on our vehicles to transport these juveniles to and from their respective places that they're at. So just a really good slide to have if you need it in the future. Just about our audits, we had some audits this year. Our Behavioral Health Administration has to renew our clinical licensure to make sure that we can continue to do these incredible programs, and they did that this year for our Community Corrections Men's Facility. We also had to do a provisional audit to open up the women's facility. Even though we've already been doing women's programming, putting them in another building, we had to have a different type of audit because they needed to come see the facility before they would allow us to do treatment. And so we passed that with flying colors. And we also had our core security audit where we looked at 101 client files and reviewed 24 standards for each of those 101 clients. This year, they've done paid for performance, and we received our 1% paid for performance given that assessment in that audit. So that went well. Upcoming audits, we're going to have now an actual, instead of the provisional licensure, the actual licensure for our women's facility by BHS. We're also going to have a PACE audit, which is really focusing on case management standards given by DCJ. They'll come in this year. And then every 3 years, we'll have a PREA audit, our Prison Rape Elimination Act, which is the entire CJA department will get audited, and we're due for that this coming year as well. So we do a really good job of maintaining all of our records so that we can have successful audits moving forward, and that's because of our staff and how diligent they are. Just a couple more slides and then we're almost done. We partnered with Willow Collective to do Caring Dads because if you looked at it, the percentage of domestic violence coming through our door was significant. So we really wanted to focus on, most of them were male, and so we really wanted to focus on how can we help that from happening for our families out in the community again. So we have Caring Dads, which is a parenting class provided by Willow Collective. We continue to do great field training hours for our new staff. We raised $1,000 with Community Corrections for United Way, which was fantastic. And we talked about our trauma-informed, being trauma-informed improves criminal justice responders, where we're doing the train the trainers. We've given multiple trainings out in our community to support everyone understanding how to connect with someone who's having a mental health crisis and how to deal with it. So that's been fantastic. We completed our gender responsivity with Dr. Opsel and continue to work with that. We're continuing with our partnership and received the JAG grant again for a continuation to continue the hard work we're doing with our gender responsivity training. We're creating a council, an advisory council with our staff to continue this research, which is great. And again, we now have a specific caseload for domestic violence, and we always had for sex offenses, but now for our domestic violence group as well. This is really exciting, and Tim would want me to scream this from the mountains, but we have an ACE award in community corrections that they began this year, that every quarter staff nominates 3 individuals that are doing just an incredible job, and these are our award winners from this past year. You'll see in the red, there's Cody Rowe and Allie Shea. They got ACE Awards of the Year. And so I will tell you, the Community Corrections had their Christmas party on Friday, and they announced all of the winners for the past year, and you would have thought someone won an Oscar. Everyone was screaming so loud, and it was very nice to see them support one another. But this is a new award this year that really has kind of helped develop some really strong, positive support of each other in the hard work that they do every year. If I weren't going to put Run Club in there, I had to put a little silent thing in there. This is our Run Club, which is great, and I just want to tell you one quick story. The bald eagle in the middle was on one of the runs. I was with another individual. It was his last day running. We saw 2 bald eagles. I made too much noise because I was so excited, so I only got a picture of one because I was like, I can't believe this, and we had to run to where the bald eagle was. But this has been a great addition. We've had Run Club for a number of years, but I think it's really a good pro-social activity to give back to the community, to focus on health, and just to have a really good sense of accomplishment. Some of these folks have never won anything in their life, have never participated in a race before. So if you want to come running, let me know, because the bald eagles come out a lot. It's pretty exciting. So we're almost done, and these are the future projects that we really want to work on in this upcoming year. We really want to work on our Veterans Court, and I really believe that we're going to get there. And I'm really excited for that, to have our 6th problem-solving court in Larimer County, which will be just a great addition. We're also going to work on our lived experience. This is new to the criminal justice field. It can feel uncomfortable a little bit, but I think all research and best practices showed that you cannot get better if you don't have people at the table that have lived and walked the walk and talked the talk. So we're going to develop that. And I believe in years to come, maybe not next year, but in years to come, that we will have employees that are lived experience, that have Larimer County identification cards with us. And I think that's the right way to go. But we're going to do it in a thoughtful way to make sure that we're doing it successfully. In the meantime, we're doing accredited peer support counselors with lived experience out in our community, and they're going to help educate us along the way. So we're really excited for that. We're also going to bring back juvenile work crews. We have room in our work end or midweek program that we can do a separate group for our justice-involved juveniles, because it's very hard for juveniles to do community service. There's not a lot of places for them to go. They have to have parental supervision. We can be that parental supervision, and Jill's staff can do an outstanding job with that. We also want to bring competency beds to our programs. So our competency beds, hopefully in April or May, will be utilizing Jill's staff and really helping them. We'll get extra training, correct, Jill, on how that works? The other thing that we're doing is we're able to fill our STIRT program, which is a 21-day program. We're going to start doing some pre-plea things. So individuals that have not been sentenced may be able to come to our 21-day program before they ever resolve their case, because they need it so badly. We've been working with the DA and the public defender to try to make that happen, and that's probably one of the first in the state to do that. We've also been working with Fort Collins on a high-risk domestic violence supporting victims, a collaborative effort, so that if there's an individual that we've deemed high risk in the domestic violence arena, that we're supporting the victim in law enforcement, pretrial, probation, all of us know about that individual so we can reduce the risk and support the victim. We've already talked about the data sharing, trying to get behavioral health and criminal justice to cooperate with one another so that we can really watch someone's history through the system. And again, all of these other things, and we'll go really quickly, but our Gender Advisory Council, we're working on that. We're working on bringing an equity, diversity, inclusion, and belonging group to CJA, independent of the Larimer County one. We're also working on a retention and recruitment next year group so that our staff can really be involved in how to keep people here, how to make sure that morale is good and develop that positive culture. We're stealing an idea from Heather O'Hare for care packages when someone first starts with us, that they'll get a good package in the mail welcoming them with our vision and our mission, but also some swag to go along with it. We're also trying to get de-escalation training for our staff that we've had in the past that's been kind of cut off from us since COVID, so we're really researching that. And we're also going to bring tablets into our program to do what's called ADOVO, which is educational programming for our folks, that offers a variety of needs that can be met, including GED, educational ones moving forward. Really quickly, because I know we have like 10 minutes, but we have a restorative justice program that's coming in. And Jill, do you want to talk about that?
Sure. We're working with a volunteer who currently works, does she work for the city or no?
No, she's a volunteer.
She volunteers with the city. But it's bringing both staff and clients and volunteers in order to run restorative justice groups within CJA. One thing that was very interesting, and it was kind of alluded to with the Veterans Court, we had 2 clients that were part of that initial training group for us. And what was fantastic is they were not held on a different level. They weren't thought of as any differently. Their opinion was sought out just as much as our victims services coordinator was within that group. And it was a very good project to have. It was our very first class that we had with the volunteer who's helping us get this going. And it was going to be very good, or it was very good, and I'm very excited to how it's going to run for the future in CJA.
Really quickly, a couple other things we're doing is right now with the grievance process, we have a triplicate form that they fill out. Now it's all online. They can go to the kiosks, and we're going to be doing that in the future. We're also still working with Boulder to sell the licensure for Lois. We've had other entities from across the country reach out to us, and we say, let's wait. Let's see how Boulder's doing first. So we're working on that, which will bring some income into CJA as well, which is needed. Working on electronic signatures. We're also working with Department of Human Services with the new statute that requires individuals who are incarcerated to have contact with their children, data sharing, so that we know when someone's coming from the jail and maybe they're coming to us, that we can communicate with Department of Human Services to make sure that that visitation is happening. We've done a really good job with the jail and DHS and ourselves to really have MOUs to start having that conversation. Some of these other things we can talk about next time, but I did want to talk about, we are going to do our little Santa Cops equivalent, which is really exciting for next year, and I wanted to make sure that we talked about that. And we're also doing different types of notifications to make people successful. Better notifications for people when they're calling in for their color. And also, we're going to develop an app that helps us with folks that maybe are more difficult that we're tracking out in the community to make sure that we can locate them and make sure that they're properly doing their program. So that, and guess what? We did it with 9 minutes to spare.
I will say.
And 61 slides.
If you want to go back super quick.
Yes.
The client notification at DRC, the app utilization, and the enhanced internal tracking for ASD were all ideas that were submitted through Empower. So it's a good example of how we are really working towards getting staff feedback heard and implemented, more importantly, within CJA.
That's great. And just real quick, the name of that organization is the annual NOCO Secret Santa Free Toy Store.
Okay, thank you.
And that's a Facebook group, and you can, I can send you a screenshot of the number if you're ready, but
Thank
cool,
you.
thank you.
And again, thank you for your support, because it's been an incredible year, and it wouldn't have happened without your support, so thank you for that.
Well, a fantastic presentation. There's a lot happening, and obviously, under all three of you, I know Tim's listening in, all three of you and your fantastic leadership. I mean, it takes, we have all these great programs, but really it takes the fantastic people who implement those programs. And we always talk about being lucky commissioners, but I am lucky commissioner. I just feel like people make the difference, and I just want to thank you all for your passion and your focus, and it's a lot of great work to be proud of. Great presentation. I'll see if my colleagues have any closing comments. Commissioner Stevens?
Yeah, so thank you for the presentation, and it was a lot of material to get through, so when I looked through the slides last night, I was like, can that happen in 2 hours? And it did, so bravo. Well, just thank you for the work. It's really, it's pretty impressive to see it all in one document. You're in the business of changing lives, and you are doing that. And I think that that's what makes me so proud when I go into community corrections, whether it's a veterans breakfast or we had lunch with some people from community corrections a couple weeks ago. And, I just, to a person, feel like the people that are involved, that work for you all, your team, is just amazing and is really committed to the work. And then the people that are committed to changing their lives because they've done something that's not right are also amazing, and they're also they're also committed. So in going into an environment where the people who work there and the people who are being cared for are also committed to these good outcomes and to getting better and to being healthy and going back into the community. I mean, it's just always inspiring. I never walk out of community corrections or alternative sentencing without feeling like, wow, this is some of the most important work that we do in our community. We really are helping people get better. And I encourage all of our representatives and state senators to come and visit because we are doing it right. And we're doing it well, and it's so evident when you're there. It's an environment that, for me, is I love going there. I love every opportunity I have to sit down and talk to people because people do want to get better. People do want to be better, and thanks for making that happen.
Mr. Kafalis, any comments, closing comments?
Yes. Just thank you very much for your good works. As has been stated, you are certainly changing lives and making our community better as a whole, so thank you. I have two questions. One is, with all this good work that you're doing, how are we letting the public know of all these amazing things that are happening? What is your outreach efforts and messaging to the community through the media, et cetera? And also regarding volunteering, how do folks, if they're interested in volunteering, tutoring, or helping with GED, how do they do that?
For the volunteering, there's a link on our website, which is actual volunteer application. And they could fill that out. That goes directly to our hiring staff and our programs manager, so that would be the best way to handle that. Emily can probably speak to notifying media, and I will say from my perspective, I'm not a big tutor of my own horn, so I have a hard time, it's a discomfort for me, but it's one thing I know that it's important to share the good work that we do. So Emily has been a fantastic leader in that way.
So I think one, I think we could absolutely do a better job of it because we've been around for a long time and a lot of folks don't know it. And part of the good part of that is they don't know we exist because we're doing a good job. However, I think it's important that we get that message out. So about 3.5 years ago, we did a 4-part criminal justice series that we did online when COVID started, really kind of educating the folks on what we do here at CJA. We should probably do that again. I know when we do like Larimer 101, it's very well received and people talk about that. We also go into classrooms at like CSU and UNC and AIM, and we present to the kids in a recruiting aspect, but absolutely we could do a great opportunity, maybe spotlight ourselves a little bit more, get into the newspaper. We have had good press when it comes to our warrant clearance event that really showed our collaboration. So that's a really good feedback because I think we should probably focus on that.
Thank you, Emily. And one thing to consider for next year is it's not generally a big audience, but perhaps you could attend some of our community conversations.
Absolutely.
And we could have one in the year that's focused on community justice alternatives.
That would be wonderful. Thank you.
Do you have anything you'd like to add, and then we'll wrap it up?
Sure, I think all the nice things have been said about the program. Practically speaking, I pulled a couple of these slides out that I'm going to keep on my desk because these have the stats for the most recent few years. So thank you for giving us something really tangible to be able to quote from. We do get questions quite frequently from legislators and others. So this is really, really helpful the way you presented today.
Thank you.
Yeah, I would agree. I've already sent some screenshots to some people that were at the conference last week, and I'm like, see, here's the numbers. So, well done. Thank you both, and thank you, Tim, if you're listening in, for amazing work. And as always, it's just great to partner with you and learn more. And thank you for helping us, opening the doors and letting us come and be involved and be participating or even learning more. It's just, I really appreciate that tremendously. It's been great for me. So with that, at 11:59, we are adjourned. Have a great day.